Hey everybody, so this is just a little orientation and introduction for the EMMS 1103, the EMT basic course. As you see here, this is the course schedule. Now note that this is for fall 2019, but this presentation will be used for multiple classes, so the dates may not align with the semester you're currently in, but the gist of it is still the same. Big thing to note is, as you see here, the days in blue are the days that I will see you. So all the dates in blue are the days that we will meet face to face. And then all the material above that blue line is all the information we're going to cover that day. So as you would see here on 8/22, it would be covering chapters 1, 2, 3, and 4 in the class. And then for the whole first section in the green is the due dates for everything listed above it. All the green stuff is right there above it. So all the assignments that are listed for section 1 in Blackboard will be due on the 26th. So all the assignments are due before those labs. So before the labs, there's going to be presentations and stuff due as well. So before this 8/27 lab, you would have all the assignments for 5, 6, 7, and 8 due. And then following that lab, the section exam is going to be due within 48 hours. So that exam will be open for 48 hours. All the exams are timed, and they must be turned in by 11:59 p.m., just a minute before midnight, submitted just before midnight on that due date that's listed. Reminder that the exams are timed, they must be completed in one setting. So again, as you see here in section 2, on the lab for 9/3, it would cover chapters 9 and 10. So all the material for section 2 would be due on this lab date. And going on one more time. For section 3, for the lab for 9/12, everything that's covered for 9/12, 11, 12, 13, there's review questions, presentations for all those chapters. Those must be turned in by 11:59 p.m. on the 11th. So then when you come to lab, you should be knowing some of the material. The way that this program works is known as a flipped classroom. So in old pedagogical traditional methods, you just came to class and we taught you all the new introductory material. Well, in a flipped classroom, all that introductory material is presented on your own time, such as this presentation. So instead of coming to class to lecture, all the lectures, all that introductory material is on your own time. So you do that on your own at home, and then when you come to class for face-to-face, we focus on hands-on and detailed learning in that face-to-face environment. So all that introductory material is being delivered to you in the online environment. That's with our presentations, you're working on case studies, other quizzes, you get all the introductory stuff done. Then you come to us to dive deeper into that material and focus on those hands-on skills, doing all the things face-to-face that you can't do at home on your own time. So before you come to class, you've watched all the presentations, you've done the quizzes, you've done all the case studies, all that forefront material you're doing on your own. You come to class, we're going in and doing hands-on stuff, basically just labs, and then we'll engage in in-depth topics and also do some peer-to-peer group work. Afterwards, once you've done all the introductory at home, we've dove deep into class, then we evaluate how much you've learned and retained by giving you an exam. So all the intro stuff on your own time, come to class, dive deeper, and then a final phase is taking the exam to assess your knowledge. This is the book you'll need for the class, Emergency Care 13th edition. It is by Pearson Publishing. You're able to get this book at the shared bookstore on the Fairmont State campus, the bookstore between Fairmont State and Pierpont, or you can get it on places like Amazon online. Typically it's cheaper online if you're paying for it out of pocket, but if you're getting it from the bookstore or you're using grants, scholarships, financial aid to get the book, you got to get it through the bookstore. The only thing you need is the book. You do not need the online access codes, the workbook that comes with it. The only thing you need is the big, thick yellow book. Be sure you read the entire syllabus. The syllabus is located in Blackboard. The syllabus is essentially the owner's manual of the class. I know a lot of you have probably never ever read an owner's manual for any vehicle you've ever owned, which you should. There's some good information in there. But read that syllabus. It'll outline everything you need to know about the class. Absences, late policies, missed work policies, contact information, what you need to do for everything. It's in the syllabus. So since this is a flipped classroom, and sometimes it's online, sometimes it's face-to-face, the face-to-face part, you're only allowed to miss 2 classes. If you miss more than 2 classes, you will fail the class. Now, if something crazy comes up, you get pneumonia, you get put in the hospital, I'm not going to fail you for that. But you need to do the adult thing and notify me ahead of time. Just like the syllabus says, you must make prior notifications that you'll be missing class. If something's coming up in the near future, you've got a doctor's appointment that you can't miss, those things are happening, notify me ahead of time. Shoot me an email before the class, let me know you're going to miss a class, what's going on, and we can make efforts for you to make up the class. But if you're no call, no shows, there's no making that up. You can't notify me 2 days later and say, oh, sorry, yeah, I've just overslept and missed class. Doesn't count. That's an absence. 2 of those, you will fail the class. The online lectures are for a grade. Now, in Edpuzzle, it does give you a grade within Edpuzzle on that presentation. I give out points, either max points or 0 points. And that's where if you've watched all the presentations in their entirety by the due date, you will get full points. So again, if you watch the presentations late, you get 0 points. Even if you got 100 on the Edpuzzle presentation itself, you'll still get 0 points in your Blackboard gradebook. They have to be watched before the lab by 11:59 in their entirety. Class time is vital. When you come to class, be attentive, be on time, be ready to go. When you're coming in there, be sure that you've got any questions you have ready, anything you need at the beginning of class about course material. But that time right before class is my prep time for the class. So don't be asking me just random questions before the class. If you have questions on material, we'll cover that as soon as class starts to the class as a whole. I don't want to just have to be repetitive and tell the same thing over and over and over again. So as soon as class time starts, we'll go through, see if there's any muddy points. If there's any areas that need clarification, we'll cover that at the beginning of class once everybody's in there. But again, that other time before is prep time. If it's something that can be answered in an email, shoot me an email. So class time, super important. Be sure you're ready to come to class, ready to go. Outside of class, you will have to do 10 patient assessments. You'll go do ride time on an ambulance, and you're going to have contacts with 10 patients. We will cover that information more a little bit later, but just know right around midterm, you're going to be out scheduling time, getting on an ambulance, doing some ride time. Most people, that averages out to around 16 to 24 hours on an ambulance, but again, as it gets closer to that, we will cover that more. This class is very in-depth. It is 7 credit hours, so this should be the class you're doing probably the most work for. There's a ton of assignments, a lot of work to do, requires a lot of your time. So time management in the entire EMS program is vital. So time management prevents piss poor performance. So proper prior planning prevents piss poor performance. You need to make time. Don't try to find it. You have to have a high level of self-discipline to make it through this class. You need to make your time to sit down, watch your presentations, do your homework, study, read the book, take notes, doing everything. You're not going to be able to find the time. There's so much busy work. Your life gets in the way. Make time to do your schoolwork. So once you've went through everything, so the end goal of the EMT classes, you've completed all the coursework, you've completed all of your time out in the field, you've gotten all your patient assessments in, you've got all the boxes checked for the class. Now it's time to go and take the National Registry EMT exam. The NREMT exam is computer adaptive. So pretty much what that means is it's going to challenge you. It's not straightforward 100 questions. There's no actual passing score. It's either you pass or you don't. So it'll go through and evaluate how well you know the knowledge. Each topic area has levels of difficulty. So if you start doing well in areas, it's going to give you more difficult questions until the algorithm determines that you know the material and you will pass. You have to pass all the topic areas in there of medical, trauma, operations, pediatrics, cardiac, respiratory, all those categories. You have to pass all of them. If you fail one of the categories, you fail the whole exam. The good news is you have 6 attempts to pass that registry exam in 2 years. So you got chances. So once you've passed the registry exam, that basically credentials you, shows that you have completed and you have the knowledge of being an EMT. It's up to the state to actually certify you. So if you're staying in West Virginia or if you're going elsewhere, the West Virginia Office of EMS will be the ones who actually certify you. So within that process, they do a background exam done by fingerprinting, going through the National Criminal Background Investigation System. So if you do have any kind of criminal convictions, you need to notify them immediately and begin conversations with them on how to ensure that you can be certified by the state based on any kind of record that you have. You do not need to disclose that information to me. Just contact the Office of EMS and begin that process. Because if you do have something on your record that would prevent you from being able to become certified, then I don't want you to waste your time in this class. So again, you'll take your national registry exam, credentials you saying, yes, you are smart enough to be an EMT, then it is up to the state to certify you to actually be able to work in the EMS field. You cannot work in any state just by passing the national registry exam. Now for a little history on EMS. So the concept of EMS has been around for a very long time. So even starting in the Neapolitan War era. So in this top left picture, you'll see that if it was in color, you could see that red cross on the front of that little chariot. So the basic concept of EMS was still as it is today, to get the sick and injured to higher levels of care. It's just in the initial phases of it, it was pretty much just go out and do casualty collection. So go out, find those troops that were hurt and sick, and get them to medical care tents or even to brick and mortar hospitals. It was just a means of emergent transportation. And if you ever watch any war movies, which I'm sure everybody has seen some kind of war movie, you'll see those troops that had that red cross on their arm. And you'll see them go out and just stabbing people with morphine, trying to make them comfortable while they, did some basic treatment like control bleeding, and that was pretty much it. Control bleeding, scoop them up, and then get them to a doctor. Then it went on a little bit more to where the care kind of stayed the same, more in a more into civilization per se, outside of a combat zone. So that was where the horse and the chariot came through. Some place you could put people in, haul them up, get them to the doctor. And then as the motorized vehicles came about, well, the only vehicles that really designed that you could lay somebody down in the back of, well, was a hearse. So the funeral homes was, hey, you call us, we'll come pick you up. And they were calling them these ambulances, so they could go and, well, if you had a dead body at your house, they'd come scoop it up, take it to the funeral home. They could also come and pick you up and get you into a doctor if need be. Then that evolved into the concept of the emergency car style, as you'll see in the bottom right. And you might think that looks a little familiar. Does that maybe look like the car from the Ghostbusters? Well, the car from the Ghostbusters was a primitive ambulance. So the emergency car, basically it was a vehicle with lights and sirens on it that could just get you to the hospital. So you'll still go and hear some elderly populations refer to an ambulance as an emergency car because, well, in their younger times, that's what they would call. They would call for a number and call for the emergency car. calling the local operator, say they need an emergency car, vehicle shows up with lights and sirens, throws them in the back of it, and then goes lights and sirens to the hospital. And it's just ceiling sound of oxygen equipped and radio equipped. So they could give you some oxygen and tell the hospital you're coming. And that was about it. That was the most primitive type of medical care. Then the show Emergency came about. In the early 70s, the show kicked off, and this is legitimately how EMS blossomed. So this was a show filmed in California based on the Los Angeles County Fire Department. So fire departments are located strategically to serve communities that are placed in order of populations, trying to spread them out to where there's quick firefighters, but just based on geographic location. So, with that design of that emergency car and whatnot, there was a group of physicians in California that got together and was like, we could make this better. What if we had people who we could train to do medical care in the field and actually be taking care of people first and be getting them to us so they're not just crashing, the patient declining throughout the whole transport? What if we had somebody who could do basic things for us? So these group of physicians got together and designed these paramedics. So para meaning all around medicine. Just taught them how to do some skills, some other basic things, how to work a cardiac arrest, control bleeding, give some medicines, and do some very basic things, but it was big. So the show came out, these two firefighters named Johnny and Roy, who rode around this little squad pickup. So it was a little like work truck type of pickup, couldn't transport anybody in it, so they would go show up because they could be there really quick to the emergency. Of course, every call they went to was blood and guts and trauma, as you see a rail car explosion in the back and patients hurt. So they would show up to these calls, start taking care of people, and then the emergency car would show up, and then they'd put the patient in the emergency car and then go with them in the emergency car to the hospital. Then that pickup would follow the ambulance and pick up Johnny or Roy and bring him back to the firehouse. So that was the basic concept of doing rapid response medical care and being able to call in reports, hook them up to a monitor, and they could send a report to the hospital and say, here's the patient's heart rate and rhythm, here's what's going on, doctor, what do I do? And then the doctor would tell them, start an IV, give this medicine, and it basically had a plain old fishing box with a few medicines in it that they could give. And that's kind of how it all kicked off. And around the same time, a show called MASH. So MASH stands for Mobile Army Surgical Hospital, MASH. So this show came out and it was based around the Korean War era, and it was same concept, military style. This was their medical tent set up, so the EMS people in the field would bring them in by vehicle or by helicopter. So if you've never seen this show or Emergency, get on Amazon or Hulu or YouTube or someplace and watch these episodes. And then if you haven't seen it, the guy in the dress will make a lot more sense to you. So overall, EMS started as a means of transportation. So everything governed over EMS was under the Department of Transportation, which is now the National Highway Traffic Safety Authority. So everything with that is still under that, just because an EMS started out as just that means of rapid transportation. The DOT governed all that. So since EMS originally started as just simply a means of rapid transportation to medical care without really providing medical care, all that was governed by the Department of Transportation, which is now the National Highway Traffic Safety Authority. So they were the ones who dictated everything by government rule. That's what they did. They write the curriculum, and still to this day write the curriculum, the objectives, all the requirements, everything needed. And then in 1970 is when the National Registry of EMTs was created, which became the testing body on the education. Otherwise, even before that, the primitive very basic EMS care was just basically done by hospitals or other agencies. Wasn't really a national broad scope of everything. So how EMS really works, it all begins from that caller calling 911, and that 911 center is emergency medical dispatchers. So they're able to take some clues of what the caller is telling them about what's going on, ask some simple things, to kind of get an idea of what's going on. If a patient is unresponsive, they're trying to get some history, trying to relay and give the EMS provider the best picture they can. They can also coach through doing some basic things like Heimlich maneuvers, CPR, so on. And then it gets dispatched out to the EMS providers. So EMS providers range from emergency medical responder, EMR, to emergency medical technician. Next step's advanced emergency medical technician, then ultimately paramedic. So an EMR is typically what a basic first responder. So pre 9/11 stuff, it was just called a first responder. Then after 9/11, everybody was called a first responder. So at EMR, they're basically trained in doing advanced first aid. They can do some basic airway stuff, do CPR, do assessments on people. So they're able to take, blood pressures, vital signs, do very, very basic things. And those providers, if they are on an ambulance, they're only really certified as a driver. They can't do primary patient care in the back of an ambulance. So an EMT is basically the baseline pre-hospital care provider. In West Virginia, the scope of an EMT is really high comparatively to other states. In other states, it's basically a ambulance attendant that helps a paramedic. Where in West Virginia, there's a large scope of practice, a lot of medications that can be given, and just a lot of interventions that they can do. In other states, you might be able to give oxygen or help a patient with their own medicine, and that's about it. Advanced EMT is a newer concept. It replaced the EMT Intermediate, which was taken out of a national scope around 2013. So basically, that's a midline step between an EMT and a paramedic. They're able to do a small amount of things, IVs, give a handful of medications a little bit more, wherein the scope of EMT in West Virginia can do more than the national scope of an advanced EMT. But ultimately, nationally, that advanced EMT isn't a big grown concept yet. It's getting there. Some other, like say fire departments who don't run ambulances that want to do some basic care, more like Johnny and Roy, who can start IVs and do things and wait on an ambulance. That's kind of where that comes into play. Not really much in the metro setting, generally. And then paramedic. Paramedic is the highest level of pre-hospital care provider that there is. That is a very high scope of practice, a lot more knowledge, a lot more interventions. A paramedic is the ultimate high level of EMS. Now, above paramedic, there's also things like a critical care paramedic, flight paramedics, and so on. But those are generally a little bit of a different category of EMS and 911 response. But those are pretty much just in a transport world. And then a newer concept coming out now is a mobile integrated healthcare provider, or a community paramedic. Those are the ones that are going out doing kind of welfare checks on people, or they get with hospitals, and once a patient's been discharged, that community paramedic can go and follow up on them to make sure that they're taking care of themselves, that they're not going to activate the 911 system. So pretty much a near hospice-esque kind of thing, to where they'll go just check up on people, make sure they're following up with the doctor's orders. So once EMS has been activated, everybody in EMS operates under a medical director. Depending on how that is, some places it's a city medical director, or a regional medical director, or a state. So in the way that West Virginia works is there is a state medical director that writes all the protocols, everything that every EMS provider does in West Virginia. They all do the same thing. Whereas some other areas, an EMT may have their own protocol depending on which city that they work in. So if they work in City A and City B, they may have two different protocols depending on which agency they work at. Where in West Virginia, every EMT, every paramedic has the same protocols no matter where they work at, and they all follow the same education, everything. So under state medical director, they write all the protocols, delegate all the continuing education, everything. And then there's regional medical directors that kind of oversee, well, a whole region of EMS agencies and all their providers. And then there's agency medical directors. So an agency medical director will oversee that agency and its respective employees. So it's regional or the local agency medical directors. That's who authorizes you to work at that agency under that medical director. And then there's ultimately an overall medical direction, or as we'll call them West Virginia medcoms, or medical command centers, or some other regions have other names like med base and stuff. And basically at those medical command centers you're able to reach them via phone, radio, multiple ways, and that is basically a paramedic that you call and talk to if you need medical direction or you're not 100% sure what to do, or if your protocol says you need to call and talk to them. And that's just a checks and balance system pretty much. And then in those protocols too, you can also talk to a physician. There's always physicians that are able to get on the radio or the telephone to also consult with you. Now in modern day EMS. EMS overall is in the top 10 fastest growing and most demanding professions in the United States. Pretty much every program I've ever heard of has 100% job placement. Our program enrollment in the past 4 years has doubled, and job placement is still 100%. Populations are growing, the populations are getting older. The concept and the advancement of EMS is just growing because it's still a very young profession, really just kind of getting into its foundation in the mid 70s. So it's just blossoming. So you're able to go and work at a variety of places. You can work at just a straight EMS agency that the only thing they do is EMS, to where they do convalescent transports where they can take, elderly people out of a nursing home to the doctor's appointments, and also do 911 response. Call 911, you go to the chest pains, the choking, the unresponsive, the traumas, everything. They can do both of those. And then you have EMS agencies that are a little bit bigger, that do a little bit broader spectrum stuff, like say, as pictured here, the City of Pittsburgh EMS. They run rescue and EMS, where the City of Pittsburgh Fire Bureau, they only do fires. EMS does everything else. Not a typical or very common concept, but a lot of EMS agencies are getting in and doing rescues as well now. And then pictured on the left here is fire-based EMS. That is one of the most growing locations of EMS. West Virginia isn't real big on that concept yet, but pretty much in bigger cities, the fire departments are running EMS. They already have the staffing, the infrastructure, everything they need. So they're getting ambulances housed there, as you'll see in that picture, an ambulance, and on the background, a ladder truck. And then the bottom picture, air medical. And in air medical, generally that is a flight paramedic and a flight nurse that are working on a helicopter. So the nurses start in the hospital side, then kind of work in backwards into the EMS side, and then the medic is starting the EMS side and then grows into the flight side and in the critical care. So pretty much every flight paramedic has a critical care extra credential. So they've been a paramedic in the field for a while, go back, do more schooling, and then get to be a flight paramedic. The Red Cross, as was seen on older EMS style things, has went into the EMS Star of Life. So in the middle of that Star of Life is the rod of Asclepius. Asclepius was the Greek god of healing and medicine. So the 6 big pillars of EMS is early detection. That's by, people seeing things, call 911, feeling things, feeling sick, getting hurt, call 911. Early reporting of getting the information relayed out. Early response of being able to respond to the call quickly. On-scene care, being able to actually do things while you're there instead of just hurry all the time. Hurry, get there, take care of them, while they're being transported to the hospital. So continual care from patient contact to patient handover of that sixth pillar of transfer to definitive care. So early detection, call 911, activating all the emergency response systems, responding promptly, providing quick, prompt care while on scene, continually caring for them while they're being transported to the ultimate destinate, the most appropriate facility. So getting them to definitive care, which means getting them to the right type of hospital, the right location. Not all hospitals have the right facility, so doing good assessments, getting them where they need to go. So who knows where the future of EMS is going to be, whether everything's going to be on flying ships, who knows? It's a very rapid, fast-growing profession. Things change almost weekly in the profession, so where it goes, who knows?